Hello everyone, welcome to my channel. I'm Dr. Emily Wang Guinier, an assistant professor in Chinese, and today we're going to have an overview on Chinese medicine. Traditional Chinese medicine has been developed over centuries throughout China's long and dynamic history. It has been effective in guiding diagnoses, treating illnesses, and explaining functions of the body that had previously been unknown. The philosophies that have developed a traditional treatment have been incredibly beneficial in treating ailments over time. Yet, there are still some concerns regarding efficacy and morality behind the practice. Today, we're going to look at the dragging meridians and collaterals external therapies of TCM. The traditional Chinese medicine's efficacy has won wide recognition from people in different countries. And the traditional Chinese medicine has gone abroad and is playing an active role in all corners of the world. In a broader sense, traditional Chinese medicine, or TCM in short, includes all different medicines and religious medicines. In addition to Han medicine, there are also Tibetan medicine, Mongolian medicine, Miao medicine, Yi medicine, etc. The physiological tradition and foundation of traditional Chinese medicine is the Book of Changes, and its Chinese name is Yi Jing. To put it simply, it's about yin and yang, which refers to the opposite or contrary forces that are complementary to each other. The external, rising, warm, and bright forces are yang, while internal, declining, cold, and dark forces are yin. Yin and yang also exist in human body. If yin and yang inside the body are imbalanced, one will not feel well and may even get sick. So what is yin and yang? Yin and yang concept derives from Taoism, which regards them as the fundamental principle of forces in the universe. In Chinese theory, everything contains those two contracting principles. For example, heaven is considered as yang, and the earth is considered as yin. Yin and yang are not simply opposed to each other, they coexist in interdependence. Thus, there will be no earth without heaven. Moreover, yin may transform into yang and vice versa. In the human body, the upper part is yang, the lower part is yin. The exterior is yang, the interior is yin. The back is yang, and the front abdomen is yin. With regard to internal organs, the heart, liver, spleen, lung, and kidney are yin, while the 6 intestinal organs are yang. These include the gallbladder, the stomach, the large intestine, the small intestine, the urinary bladder, and the triple wormer. The harmony of yin and yang produces good health. Disharmony leads to disease. Therefore, traditional Chinese doctor uses acupuncture, herbs, and food to help correct an yin-yang imbalance until the body returns to a healthy state. For example, a preponderance of yang may lead to hyperfunction of an organ or heat manifestations. So cooling drugs are used to inhibit the excessive yang. On the contrary, a predominance of yin leads to manifestations of cold or weakness in functioning of an organ. In this case, warming drugs are used to restrict the predominance of yin. The principle of Chinese medicine is to recover the body through the method of acupuncture, moxibustion, tapping, scraping, and Chinese medicine to regain the health state of yin-yang balance. In this section, we will focus on the external therapies of traditional Chinese medicine. There are various physical therapies in Chinese medication, among which the most well known are acupuncture and probably moxibustion as well. The therapeutic effect of acupuncture and moxibustion is legally recognized in many countries and regions worldwide. Acupuncture and moxibustion include the acupuncture therapy and moxibustion therapy, which treated disease through needle puncturing and firing the acupoints on the human body, and a non-material cultural heritage designated by UNESCO. Acupuncture is good at easing pain and treating neural diseases. The question is, does acupuncture cause pain? Actually, patients have different sensations. They may feel sore, numb, warm, or swelling. But many say that they feel relaxed when the needle is inserted beneath their skin. Many doctors commonly use 6 to 8 needles during one treatment for most of the times, but they might use 10 or more needles if 2 or more symptoms need acupuncture treatment at the same time. For instance, if a patient has both back pain and a headache, the acupuncturist treats him or her for both symptoms at the same time. Some acupuncturists insert as many as 30 needles or more at the same time. Normally, each treatment would take about 20 to 30 minutes. However, this depends on the sensitivity and condition of the patient as the disease is treated. Generally speaking, the success of a treatment depends on the experience and skill of acupuncturist, on a correct diagnosis of symptom, accuracy in hitting the acupuncture point, the timing and the depth, as well as the angle of insertion. And Chinese medicine believes there are 12 main meridians throughout the human body. And here's an illustration of 2 life-sized bronze acupuncture statues in the Northern Song dynasty. Moxibustion. Moxibustion is easier than acupuncture. Although its effects is not as fast as acupuncture, it is simple to implement moxibustion, and the treatment can be done by ourselves. Moxibustion is suitable for treatment for chronic disease and daily health care. Involves burning of mugwort, a small spongy herb, to facilitate the healing and help with the flow of the qi. Its function include invigorate the blood, stimulate the flow of qi, expel wind and disperse cold, and for a lot of times nowadays is used for treating menstrual pains. Cupping. In addition to acupuncture and moxibustion, another popular external therapy of Chinese medicine is cupping. The cup can be made of a variety of materials, include glass, bamboos, and earthenwares. The mysterious red marks on Philip's back is a result of cupping, and the bottle on Neymar's back is a cupping tool. Cupping uses the cup as a tool and attaches to the skin under thermal or vacuum effect, absorbing salted swell out of the tissue to the body surface and eliminating local swelling as soon as possible. It's pretty effective for acute injuries and delivers the effects of smoothing meridians and collaterals, invigorating blood circulation, dissipating the cold, eliminating moistures, detoxicating, and repelling fever. Massage therapy. Among the big variety of physical therapies of Chinese medication. Nobody can resist a massage. Many countries have their own unique style of massage. For example, Western massage focuses on relaxing muscles. The Thai massage is good at activating joint. Korean massage prefers hot compress. How about Chinese medicine? Massaging is usually for medical treatment, such as bone setting therapy, and it focuses more on acupoint, meridians, and collaterals. Massaging demonstrates the activity of fast recovery. More importantly, since Chinese traditional medicine emphasizes the accurate hand feel of acupoint, meridians, and collaterals, it offers many job opportunities for the blind people in China. In this class, we have introduced some typical external therapies of TCM: scraping, acupuncture, moxibustion, cupping, all of which are based on accurate points, meridians, collaterals. When our ancestors went hunting and got injured or get swelled, they pressed the swelling part and applied a hot compress on body after getting injured. For more than once, people found out that the swell diminishing effect is very good, and such experience is handed down as a result. The treatment system is not a wild fancy, but based on Chinese people's practice in the long history. Dragging meridians and collaterals to clear and soothe blood circulation is one of the secrets for Chinese people to keep healthy. And in the next session, we will look at the food therapy. Thank you for listening. If you are interested in my video, please subscribe and like. Thank you. Bye.